So, David, I'm hoping we can revisit the conversation we had last week about the budget because a lot has happened since we last recorded. It sounds like, on the one hand, there's progress toward a potential continuing resolution to fund the government through the end of the fiscal year, which is September 30th. The current funding runs out March 14th, and so they're on the clock. The House and Senate have to reach agreement and then have agreement with the president. So let's start there. Are you hearing that let me do this in a series of questions and you just have to say yes or no. So question one is, do you think there'll be a shutdown or do you think there'll be a continuing resolution?
Okay, Todd, the answer is yes and no. I know
Okay.
that's not what you asked for, but that's what I'm going to give you. Yes and no. It's quite possible that it'll happen. There's no real way it helps anybody, so I'm hoping they figure out a way not to do that.
So
Next
now
question.
shut down. So working with the assumption that there will be a continuing resolution, do you think the continuing resolution will be short, say for a month or so, or do you think it will be through the end of the fiscal year, September 30th?
I would bet right now on short, but things are changing very quickly right now
So why do you think there will be a short CR?
because I don't think the Democrats and Republicans can agree to anything other than just a CR. And there are some things that both sides, but particularly the Democrats, want to address this year. And so to do a CR that goes all the way through to end of September, doesn't have some of the fixes that they want, is not in their favor. So they are basically saying, then do a short one.
So we're going on the record here is that there will not be a government shutdown. If there is one, it's for like a day or so. Then the House and Senate, Democrats and Republicans, will come together on a short-term agreement to fund the government through, say, the end of March into early April. That will then give them time to address a few issues. And my assumption is there'll be both a series of cuts and maybe a few spending increases. And I know one of the big potential spending increases has to do with the quote unquote doc fix. So why don't we focus there before we move to a different topic?
That is correct, Todd. The doc fix is one that I think everyone would like to see. That had been included in the deal that did not pass in December for various reasons. And now that would be an adjustment to what Medicare is paying for doctors. There's been some serious cuts this year that included, and that's been happening for the last several years. So I would expect that one to happen. And I also think you're correct that if there is a shutdown, it will probably be taken care of within a matter of days or a week, but it would not be one to go on for an extended period of time. It would be very unwise, I think, for the administration or for anybody right now to do that, to hold out for that.
And can you just, before we move to our next topic, just summarize what ASN is doing to try to be supportive of the doc fix?
ASN has been supportive of this all along. We've worked very hard to try to make some difference with it when it was still in rulemaking, but CMS felt that its hands were tied. That's the Centers for Medicaid and Medicaid Services by what Congress had done. And so Congress would have to fix it. And that's what we have been working on, along with, a lot of us are all working on it. We are a member of the American Medical Association. We have been a part of that as well as our own efforts and other groups to really try to address the doctor fix. There's been an agreement with everyone in the House of Medicine. A bill has been introduced, and we have supported it, and we have joined, and just pretty much everybody who's in organized healthcare and also with medical society, all of the doctors groups have come together on this and are all supporting it. So that is one thing that we are all doing. We've done call outs to members to reach out to members of Congress. We've written to members of Congress. We've met with members of Congress, and we will continue to work on this, I think. And it's a very important thing. And then hopefully at some point in the future, there's going to be a permanent fix to what's going on. Because the physician fee schedule in Medicare has no inflationary adjustment right now. And that's not the case for other Medicare programs. And it just is not working.
So you mentioned proposed rulemaking. Why don't we move to another issue, which is in one of his first acts as Secretary of the Department of Health and Human Services, Robert F. Kennedy Jr. Basically said that the agency was going to quote unquote rescind proposed rules. And can you just help us understand both sort of what used to happen and then what he's proposing is going to happen and what this means for ASN and for nephrology?
There's some confusion about exactly what would happen to rescind these rules. There's been some level of switch every time there's an administration change in the White House, going back and taking certain things that were finalized within a certain amount of time, business days between the election, between when they were finalized in the election. And that gives the administration, the new administration, the ability to kind of overcome things that might have been pushed through at the very last minute. And every president has used that option. But what they're suggesting here is that they may go back and rescind rulemakings in other ways that I'm not real clear on exactly how that would work legally. So I think we're back to the conversation we've had for some time now on this is going to have to go through the courts as well. There's no doubt about it. What will happen is that we everybody, depending on what rule it is that are impacted by it, will join into those lawsuits. And you have to have standing to join a lawsuit. So for example, we would have to, for ASN to join into one, we would have to have standing. It'd have to be an issue that impacts us and the people we work for, the doctors and their patients directly. So that's the thing that people would be looking at. All the other groups in the United States for whether they would look at a rule and say we're going to oppose that in court. So that's who is a big question of standing, and then what and when and where is another question that it's involved when you file a lawsuit. So we're going to be watching that very carefully. We don't know just yet. There's several big questions that I would love to have the answer on, and kind of my job to give you and the council and ASN members an answer. And I would like to have a clear answer, but right now we're still working on it.
And you mentioned the courts. I mean, just really quickly, I mean, one of the things I wanted to touch base with you about is that the courts have said that they've raised legal concerns about the decision to unilaterally cut the indirect costs at the National Institutes of Health to 15%. And so it seems like, I mean, at least in my mind, the decision on the proposed rules is not dissimilar legally in the sense that, institutions have one indirect cost rate with the federal government. And so if one agency says, well, it's going to be 15%, well, what about all the other agencies? That's kind of one issue. And then that really applies to this proposed rules issue, which is if HHS starts saying, we're going to have our own approach here, could you even do that legally in terms of the other agencies? So there's a lot of confusion. So anything else on either of those topics before we move to our final issue?
Well, I just will underline what you just said, Todd, which is basically when the courts begin to find there's irregularity across the board, that's when you generally go up the system and you end up at the Supreme Court. And there has actually been one Supreme Court order already, which basically it didn't necessarily fix everything for the administration on what it was that was being looked at, but it basically went back and said, look, this had to do with foreign aid. Look, the judge that issued this stay and this falls these freezes, you're going to have to be. They sent it back to him. They didn't overturn him, but they said you're going to have to be very specific about what the government has to do, what are the steps. So that is kind of the thing I think you'll see happening a lot.
Yeah, and I think, if I now with a couple of weeks of the administration and of the unprecedented DOGE effort, I think what we're seeing is a negotiating style, if you will, of come in and do the most dramatic thing first, see if that's successful. In almost every case, either there's been an internal pushback that's made a case and so it's been reversed or it's been adjusted, or the courts have stepped in and said, no, this is not allowed. And then there's been some back and forth. And so it just seems like 2025 will be the year of chaos, but also a lot of back and forth between the administration and the agencies, between the agencies and the broader community, and then the House and Senate. So I feel like there's just a lot happening all at the same time. And as you said, part of our job is to be tracking this and prioritizing it and trying to figure out where best we can be helpful DocFix being a good example where, not only can we join with the rest of the medical community as led by the AMA in this situation, but also start to dedicate resources. We have a group of people going up to Capitol Hill in a few weeks. This will be one of the issues that they address, et cetera. So I do think it's just, I don't know how else to play this.
Yeah, I agree. We just have to stay agile, and we have to be thinking fast, and it's hard to actually see that sometimes. Um, uh, but basically, we're trying to convey that so people understand it, but we are basically waking up every morning with moving targets, trying to figure out exactly what's going on and where it's happening and what to do about it to make sure that what is needed for everyone in nephrology to do their jobs and take care of their patients is in place. And I think you wanted to go to another issue that would really kind of hit that. Is that right?
Yeah, I do. I mean, I think, this is the beginning of a conversation around what's happening at the VA. So the Department of Veterans Affairs has announced, major cuts of about 83,000 jobs. I think what's important to understand there was an expansion after 2019, and so the thought is that they would go back to the pre-2019 numbers in terms of their employee census. About a quarter of VA employees are actually veterans, and so I think that's one question. And then the second question, of course, is the VA health system, which includes a very robust research program, employs a lot of physicians and PhDs and nephrologists. And so, again, it's very early. And so we just need to flag this as an issue that we are tracking. We do a lot of it with the VA. For those of you interested in coalitions, there's a group called the Friends of VA Healthcare and Research and FOVA, and we're involved in that. And so again, this is early, but obviously there's a lot of confusion and questions as to what's happening at the VA healthcare.
Yes, Todd, the VA is extremely important to ASN and to ASN's members. A lot of ASN members work in the VA. A lot of people with kidney diseases are treated in the VA. A lot of research is done in the VA. This proposal to make this major cut, I'm not quite sure exactly what happened right after 2019. We were very focused, as you know, throughout the COVID epidemic, with a lot of things around how to make sure care continued during that difficult period. But I'm not sure exactly why they're claiming that there was such an expansion at that time. I'm not saying that it's not correct. I'm just saying I really don't know the answer to that particular piece of it. But there's one thing I do know very well, and I'll say it very fanatically. There are a lot of people on Capitol Hill who are very, very, very loyal to veterans and veteran issues. This is not something that will happen without a conversation and without people having to compromise on what they want to do. I do not see this as an easy, like, oh, we're just going to do an executive order and then boom, it'll all be done. I think Congress will be very, very willing to step in and say, no, we're not doing that.
Yeah, I think that's a good place to end. I mean, my sense is there's been a tonal shift over the last couple of weeks, and you can look at the polling data, you can look at the markets. I think you're starting to see a lot of questions around some of the policy directions. I'll keep this at a macro level, and as you said, making these sorts of cuts at the Department of Veterans Affairs will also have an impact because the VA has a presence throughout the country, and so for members of Congress, they're going to hear very clearly the same way many of them are hearing in town halls about concerns if it's NIH funding or other or potential cuts to the Medicaid program. So I think there's a lot for us to discuss in the weeks and months to come. So perhaps we stop there. And the next time we record, it'll probably be after the 14th, so we'll know if there's a shutdown or not. We will record either way, even if there is a shutdown. And thanks, David, for taking the time.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.